Hello, my name is Dr. Cheryl Burdett. I'm the Educational Director and co-founder of Precision Point Diagnostics. I wanted to share with you some patterns that you would look for on our wellness panel when you're trying to identify issues of B vitamin deficiency. The first thing I want you to draw your eyes to is uric acid. And when you begin to see a uric acid that is around a 6 or above, begin to think about well, of course, when it's high, we think about gout, and it can go up in response to oxidative stress. But another reason you can begin to see uric acid creep up besides gout, besides metabolic syndrome, is because of a deficiency in folate. And so the folate family, typically from leafy greens, and the most active form, 5-methyl tetrahydrofolate, can be utilized to help lower a uric acid as it goes up. The next markers that I want you to think about in terms of B vitamin deficiency are your AST and your ALT. And at this moment in time, we're not thinking about we're not thinking about high levels. Of course, they go up with liver damage, but I want you to be tuned into these in terms of low levels. Low levels can be a result of a B6 deficiency. We need B6. It is to drive a transaminase, and that's what the T stands for here. These are transaminase reactions. And so B6 as a cofactor is required to make AST and to make ALT. So low AST and ALT, like a 4 or less, can give you a picture of a B6 deficiency. The next ones that we should think about in terms of B vitamin deficiency are, of course, this category here when we're looking in terms of what we would use to diagnose anemias. And so when you see your MCV go up, and when you start looking for this pattern, even within the reference range, when it is greater than 90, you want to think about a deficiency in B12, B6, and also folate. Particularly B12 and folate. Of course, these will go up with megaloblastic anemia, and your MCV, when that's above 90, this can show you deficiencies in B12 and folate. We need adequate levels of B12 and folate to turn off the DNA that tells the red blood cell to stop growing in size. And if there's not enough, you'll get these very large red blood cells. You'll see an increase in mean corpuscular volume. And so this tells us about a deficiency there. MCH and MCHC follow the same pattern. So when you see these drifting up, 32 or above 30, these can be times that we want to think about B vitamins as a deficiency. The next marker that we want to think about in terms of a deficiency is if you keep giving magnesium and you don't see it go up in the serum, this can also be indicative of a B6 issue. We need adequate levels of both B6 and taurine to retain magnesium, to not lose it through the kidney, and to make sure it's making it into the cell where it's most appropriately utilized. Markers of oxidative stress are not really they don't tend to tell us much about B vitamins, but if you'll drop your eyes down to HDL, of course we know you can have a low HDL when you are deficient in a different B vitamin, niacin. And so when we see a low HDL, we're also thinking about that B vitamin family, and particularly using niacin to move that marker to where it would be more appropriate. Then you finally, we also would be looking to homocysteine as a marker for methylation issues. And so homocysteine will go up when somebody is not methylating appropriately. So of course, again, one of the big ones we want to think about here is our folate family, and 5-methyl tetrahydrofolate is going to be the most effective in terms of lowering a homocysteine. But of course, B12, B6, and actually even a little bit of B2 are all involved in helping to reduce homocysteine, and so more indication of when B vitamins are needed. So when we look at the wellness panel as a whole, it gives us many places, many reasons, patterns that we can see in terms of B vitamin deficiency, so we can use these markers not only to diagnose pathology, but also to tell us more about the nutritional status of the patient.